Most patients who are having a test performed, somewhere in the back of their mind, either they or their family members are worried, could it be cancer?
I'm the first one often that has to say, no, it's not just a cyst.
I try to be very open with them about their disease and be as supportive as possible and be positive, but also be realistic with them.
If I can meet somebody who's scared or angry or upset, bring some peace to the situation and say, we've got a plan, this is what we're gonna do, it really helps give the patients and their families back some control that they've been robbed of.
Williamson Medical Center has a longstanding tradition of a comprehensive cancer program and taking cancer care really seriously. So here at Williamson Medical Center, we have dedicated proceduralists and diagnosticians and cancer doctors that meet regularly.
Having this multidisciplinary approach to the cancer patient is extremely important. When it comes to cancer, cancer doesn't really fit into one particular category. Sometimes it requires surgery, sometimes it requires radiation, it requires interventions from pulmonologists, and it requires so many people giving opinions that we need all of those opinions to make sure we come up with the best plan for the patient.
We have really easy communication with each other so that we're really trying to streamline the approach for the patient. We're trying to make sure they get that education that they need, the support they need, so that they feel like they took a part in their own health care and their decision making and feel comfortable with those decisions that they make.
When you have the diagnosis of cancer, speed to the patient is very important. From the time of diagnosis all the way through treatment, it really helps to have a group of physicians and other support staff that allows that patient to move through a system very well.
Most hospitals our size and geographically don't have anywhere near the level of sophistication, expertise, and also patient support that we have here.
What I really think makes it special, though, is not just the level of the technology, which is, of course, going to be excellent at Williamson Medical Center, but also the level of care. When they're going through their biopsy, my staff will just quietly be there holding their hand, literally, not just figuratively. There's an attention to detail and their comfort and the supportive atmosphere that is, to me, the difference between getting the job done and really taking care.
So as the cancer liaison for Williamson Medical Center, I'm pretty intimately involved in not only the cancer care of the patients that we have here, but also administrative decisions, kind of directions that we're heading. We've got a monthly cancer conference where we talk about all of the patients with new diagnoses of cancer here at Williamson Medical Center. We've got quarterly committee meetings where we talk about higher level administrative things, administrative decisions, accreditation, policies, initiatives, and quality control.
When we talk about these patients in the interdisciplinary conferences, because I've met her at that first diagnostic workup, I've met her through her biopsy, everyone in the room, we know these patients. These are our patient, all of us.
The whole team is there to discuss that case, make sure nothing is missed, that they're getting the highest quality of care. I think that with that very coordinated team effect, the multidisciplinary approach, all there face-to-face talking about a case, that we're just making sure they have their best possible outcome.
I think thinking about not the cancer, but this person, what's going to be successful, what's going to be safe, what's going to be tolerated by this patient, and the goals of how they want to deal with this, and then communicate together to personalize that therapy for that individual. I think that's what a smaller program like this allows us to do.
There's been improvement in mammography, 3D mammography for patients in screening for breast cancer. We now have new techniques both with endoscopic ultrasounds, both in the lung space as well as the gastroenterology space. So we have physicians who are very well trained to do what's called EBUS or EUS, where they can help make not only diagnosis, but help us stage a patient, not only expeditiously make a diagnosis, but how to help plan for their treatment.
It's important to remember all the things that cancer can't do, and that cancer doesn't affect. It doesn't affect your family. It doesn't affect your faith or religious practices or background. All of the things that give you strength, those things are still there, and they're an important part of your treatment plan. That's part of why I enjoy the work that I do.
When a patient is told they have cancer and they come to see me, and then I'm able to resect that area, and then we find out in the final pathology that it's earlier stage and that they don't need any further treatment and their chances of it coming back are extremely low, that's extremely rewarding for me.
The best part of my job is caring for patients. Hearing the diagnosis of cancer is so life-changing. And no matter what cancer you have, to face that patient in a compassionate way and offer them the best care for whatever outcome they may have and hopefully cure is an amazing calling.